Hi, this is Pamela Wirth with the Encourage Your Wellness podcast. And today I have Dr. Ahmed. He's a nephrologist, international speaker on digital health and telemedicine. He's also the founder and CEO of American TelePhysicians, a Florida-based and award-winning virtual healthcare company with operations in the US and international markets. Been named one of the top 20 CEOs of telemedicine companies. And there's so much more, doctor, here in your background. And I don't necessarily want to read it all, but look forward to getting into all of it with you. Thank you for being here.
Likewise, pleasure's all mine. Thanks, Pamela. Thanks for the opportunity.
Yeah, so you've been involved and a member of the advocacy committee for telemedicine legislation and policies on Capitol Hill, multiple events at United Nations forums, and consultant for WHO and UNICEF. Healthcare innovation is obviously top of mind for you. Tell us, how you got into this, where you think healthcare is going, and what really gets you excited.
Thank you. Yeah, long story, but I will try to make it short. I am a nephrologist as a profession, kidney specialist and a hypertension specialist. I'm based in Jacksonville, Florida. Moved to Jacksonville, Florida in 2014. Prior to that, I was in Cincinnati, Ohio, Delaware, and so on. And my perspective for healthcare, obviously, when I got more exposure in the private care settings and start seeing patients, especially with the chronic care management and senior living facilities. And one of my also key motivation was, unfortunately, the disease of my mother. She unfortunately passed last year for chronic liver disease. And so I immigrated to this country, the US, from Pakistan, and I have lived in different parts of the world before moving here in the Middle East, in New Zealand and England. So got some exposure of healthcare system in different parts of the world. Of course, when settled here, then my parents used to visit me once a year or twice a year, and I used to go and see them. And so when my mother was diagnosed with this disease, how can I be kind of more involved practically as a caregiver while I'm not with them physically? And this was, I think, the 2015 or 2016, I started looking into telemedicine as one part of the approach. And of course, this was way before COVID. And one of the challenge which as a physician, you see that telemedicine was perceived as just an online consultation with doctor, which obviously improves the access issue, but for sure that, rather than going to doctor's office and all. But that is a very limited aspect, because when it comes to a specialty care, as a specialty physician, and in order to give continuation of care, you want to have access to patient's medical record. You want to have later on, you order blood work, you order other imaging studies and all those things there. So like, for example, if we are sitting obviously in different parts of the country, so in order for me to manage you remotely, I need to have information about your healthcare, as well as you also need to have information where, if I need to order some other ancillary services, where to find that. So that actually led to the whole idea that it is not just an online consultation, it's essentially a complete ecosystem. And I think that's intrigued me. And I was pretty intrigued by the concept of this startup, and reading about how technology shaped some of the industries. Jeff Bezos, for example, the e-commerce market, and then Uber has really revolutionized how one problem led to the company. So I started thinking more deep into how to build this in an online healthcare ecosystem, integrating care. And I think ever since when you start seeing from that lens, you also start realizing more deep how the big issues are in healthcare. And a lot of time I talk is the US being such an advanced healthcare country or system, but it's not the most efficient system. We all know that, because there's so much the cost is much higher than the other countries, and despite having all the resources. And the challenge has been that the care is not integrated and so on there. So when you start seeing from that lens, and then on the other side, start seeing from the patient's lens as well as their family members, that led me to kind of start. So luckily, I was joined, I joined hands. So some other physician friends, I talked with them. I talked to my brother for establishing an IT company and so on there. So we essentially evolved as a company which understands from the healthcare and specialty care, but then with a mission, how can we utilize technology to solve, I would say, three problems of healthcare, three A's: access, affordability, and awareness, patient education. So that's what I think led me to kind of start this. And the first project we worked was to help my mother to, online care platform. By sitting in here, you could order services back in home country in Pakistan. How can you get all the services? You could get the care at home. And seeing that service actually deliver was such a gratifying, because this was a start of one solution which can help millions of family members who are not necessarily live in the near with them, but they can actually utilize and unite by the technology, and you're closing the gap. And then of course COVID came, and then further it became very telemedicine became quite popular. Right before that, I think when I started presenting this, also I got the opportunity to present at the United Nations. We were invited by the United Nations for a digital health conference, present this idea of having an online healthcare campus. And we all see now universities of online campus. We have banking is online, but when it talks to healthcare, getting everything online, that's where the big gap is there. Last, but I think the other piece, which I think was very important when I experienced as a patient myself, you'll be maybe surprised, but I got MRI of my back, and I did have insurance, never used it for the whole year, and then finally I use it, and then to my surprise, I saw the bill of $1,800 for my MRI. And I said, like, I'm a physician, and I thought, like, I knew healthcare, and I called my insurance, and they said, oh, you should have, because now the study was done, so you're liable for that. And then I started learning more about deductible, and then, and then even you haven't met deductible, the price difference can be. So we have this platform. Then after that, we started working on this platform, Cura, CURA for you. Same MRI, we have over 900 radiology centers. And we build this for patients who don't have insurance or high deductible plans or no price transfer, the surprise bill, just the price with the services are listed with the price transparency. Same MRI starting for $300. So you can imagine like how people did. I mean, it's such a system where you think you have insurance, then you will have a less cost, but that is still not the case. And then even if you don't have insurance, even a deeper mess. And then if you're dealing with a senior citizen coming to the the transport, logistic, and all things there. So, but every one problem is linked to other one. And this is where we started working on kind of model where how can we build an integrated platform where essentially as a patient and caregiver, bringing their problems, solving their problem first, and then on the back end, you start solving the problem of the physicians and, and those others. And I think certainly looking forward, it's still a long journey, but I think we have come way far where we started.
I absolutely love this. So I've had a couple of personal experiences in my life where it's been incredibly difficult. So the first one being my son, around the age of 5.5, he started exhibiting strange voter, mobile, and mood problems, depressed, anxious. They said he had Tourette's, OCD. And so it took about a half a dozen doctors later for someone to say, let's pull some blood work and find out what's going on inside. They wanted to give him medicine for the symptoms without kind of finding out why first, right? So, but all of that lab testing was so cost prohibitive. I wasn't going to say no, but I actually sold my car and bought a much cheaper car so I could pay for lab testing. Thankfully, fast forward many years later, you can find these things. I don't know that we're necessarily aware of them as much as we could be or should be. I still think it's hard to find where to find cost-effective care, but thankfully the technology is caught up. And consequently, and I love your platform, because having to go through and fill out the paperwork every single time. And then with my mom has had 90 days to live, going on 6 years. She's doing great with stage 4 cancer. But I've, gone with her every single time to different appointments, and it's the same paperwork over and over again, and the same history. And, it's all these, and then, I can't always be with her, similar to you. And so it's having to manage these things. Because she can't necessarily figure out how to manage the online appointment. So I'm
Mm.
having to manage the online appointment and manage her. And then, obviously communicate with the practitioner that it's okay for me to be present. And so I love what you're doing, and I love the access. And I think the affordability, I think, is coming with the technology that's been, continuing to be enhanced. I think the awareness is still a challenge. And so how are you helping practitioners, helping consumers? Like, how do we let people know where's a safe place to go? No, this isn't spam. What's okay and what's not. I think that's, really, really still a big challenge.
No, thank you. First of all, thanks for sharing your story, which is a very common, and I hope your son is doing better now. And
He's doing
I mean,
great.
this great, good to hear that. This exactly, I think, was what the main challenge has been. A lot of time the affordability and all the things there, and then we know there's such a big price difference when you can, and finding the right care at the right price, I think is the definitely the fund is needed. And now coming to your other question, how to patients can find. I mean, this is very essentially important also for chronic care management, especially because the patients want to see same doctors and all things there because they know the history. Otherwise, if you keep switching, one of the challenge for the telemedicine is that initially you go online, you see one doctor, and then next time you come, you see another doctor and all things there. That may work for urgent care, like sore throat or one-time fever. When it comes to chronic conditions, you obviously that is not how the care is efficient care is delivered. So, and that's where I think the first fundamental is to make sure that you have access to the same physician for condition care, and then that physician also has access to all the data and everything. Now, the how to find patient, like they can find the reliable. I think the doctors, and being a physician, you can definitely say that I'm a bit biased on that, but I think the universal truth is the healthcare is centered around that patient and physician relationship, because I think that's where everything else kind of branches out. And it's what I also learned practically, having a medical knowledge is great, but you also have to be compassionate, because I think the patients and the families, they listen more, and then they care if you are compassionate care. So I think that is the most important thing when you're seeking a physician who understands and listens to their problem and then share. Of course, and then further is we expect those physicians and caregiver providers that they are giving that advice ethically, because obviously there are always a business side of financial aspects. And unfortunately, we all have seen or witnessed some of these horrific stories, which they should have not been. But I think in the current world, and also there most of the time, patients kind of can relay that. They can sense that, and this is where the quality checks matters. Good thing is, at least in the US, all the companies who work with this, they, have verified information that licensed doctors and kind of all the other service providers is kind of a general. So having a spam in healthcare, the chances are less. However, certainly the big problem people end up having is what I call, we move from a paper mess to digital mess, because then there's so many platform and all those things there. So, but you can't expect patients to, I'm going for a migraine, I will go to and find another platform and going there. Now for my blood pressure, I'm going to another platform, and And then, so on there. And then if they don't have this, so now you can imagine how much paperwork. You're still digital, but you're still paperwork there. So I think it's the government policy on the back end is very much important, and they are enforcing it. But I think there's still a lot of gaps and challenges, and there are a lot of, a lot of kind of those unseen forces, I will always say. Sometimes they are delaying it. So once that happens at the government level and the regulatory, I think that will be helpful. I also see some positive developments happening, but I think it still needs to be done. For example, in telemedicine, cross-border licensing issue is a big one. I don't think there is it's not about a physician shortage, I think it's the relative physician shortage. There is certainly physician shortage in some areas, but it's so complicated because then if I, the same, you do this as a physician, you are a board certified doctor across the US, but then in order to have a license, it's so much difficult to get a license. Like, so luckily now this IMLC, which is Interstate Medical License Compact, more states are adopting to it. It's making easier. So I think then that will also solve some of the problem of the access and the physician shortage.
Well, I think that also applies to the physician assistants and the nurse practitioners. And I mean, just because you've got the doctor also needs a lot of support. So there's a lot of other things that go into all of this. So in terms of next steps, tell us a little bit about how people can find you, where people can really look out for cost-effective and better platforms.
Absolutely. Thank you. So we, as a company, is American TelePhysician, which is our corporate company, and we are a physician-led, what I call a physician-led healthcare incubator, where we partner with physician groups and healthcare service provider, and we have launched a couple of platforms for some of them are disease specific and some are like general for patients who don't have, for example, I think more important, like the one where patients who don't have insurance are mentioned there. So it's online, it's called Cura for you, letter U, and they can go online. They can also download the app, and then it allows them to having access to one app or one platform, access to online doctors, and then we have partnership with labs, Quest Diagnostics, and like 4,000 labs. We have over 900 radiology centers. We have a home imaging companies, and then we have launched some programs, a sleep program and weight loss program, and so on. There's like the things are a lot in the pipeline. So they can find, and then all you have to do is like see the pricing, and then you need it, and then go from there. This platform is also helping now small business and employees, because then a lot of time you have 1099 workers or part-time workers. As a business owner, the biggest cost is the healthcare. One of the biggest costs, healthcare benefits. So it's typically part-time or 1099, they don't get any benefits. But I think this is an opportunity just for $9 a month. It's a subscription which will give you access to healthcare coach, as well as then access to all the services. And then they can essentially, whenever they need it, they can use outpatient services. One of the big area, I think, is the focus on the wellness side, because unfortunately, our current care model is more focused on hospitals focused, because like you get admitted to hospital, and then this is like what I call chasing the tail, like and then so how to prevent that progression of disease. That's where I think where the initiatives are. Medicare does wants to promote that, but then so with our company, we have build our technology, and now we also have AI built into this technology, which is like do the early risk assessment, and then the system will, based on your current profile, what's your cardiac risk, what's your stroke risk, and so on there. And then based on your risk assessment, customize care plans. This certainly help to early detection of the diseases, and then if you find it, and obviously it slow down their progression, and your an early intervention. So one of the example is our NeuroX project, which is we launch for the to combat stroke and dementia care, and we recently won a contract by Medicare for innovative guide program for dementia care and helping patients for early screening and providing their care, as well as the resources for caregivers. So these patients can stay at home. I mean, otherwise, you can imagine if you have a patient's family member with dementia, or unfortunately, a family member who had a stroke and is not very active. It's certainly a very debilitating condition, and it's also very stressful for the family. So with our NeuroX platform, we are helping families for management of for early dementia risk assessments, as well as patients who had a stroke or at a risk of stroke, see a neurologist or see a psychiatrist for mental health or something there. So that's where we essentially are, providing access to our senior citizens.
And so do you find that most of the people that are on the platform are of a certain age, or do you take care of people across the entire family age spectrum?
So no, across the age spectrum, obviously the big focus is on since our big focus is on chronic care management, and we see that the naturally people, senior citizens are, if once you're above 40, I won't call senior like that, obviously when you are at that age where middle age and when you start having these problems, diabetes, hypertension, and so on there, then definitely that's where it becomes. But when I look at the company, the two verticals which we were very much focused, one was people who don't have access, like self-pay. So that is across the age spectrum. You maybe, you're a visitor, you are 1099, you don't have insurance coverage for you or your children or so there. So we can provide, that platform provides the care. And second is people who are senior citizens living in senior living facilities or home, because they are the often people who have multiple problems, and it's hard for them to go to the doctor's office, wait for so long, and then they typically, you can see that they require multiple consultations. And what we essentially building that with the technology, I already talked about the risk assessment, but I think the other part is after providing them consultation, utilization of the remote patient monitoring, I think is a big one. Wearables technology, Fitbit, Apple Watch, and blood pressure devices. So it's all about helping their day-to-day data for the clinical data, and then providing that clinical data into utilizing AI, helping physicians and the care providers so they can actually adjust their medications. So imagine that the case scenario. I do hypertension clinic. So my patient, we get as a physician, so we give them this blood pressure devices at home. So they're taking the blood pressure readings, and our nurse gets all this monitoring and their automated alerts. And then based on their readings, their medication can be adjusted. You'll be surprised. Not only we have prevented a lot of hospitalization with that program because their blood pressure, let's say, before it gets too high or too low, but in reality, I've also taken more patients off the blood pressure medicine than put in, because what was happening, they were coming to doctor's office and they were anxious or something. So the previously decision was being made on the one or two blood pressure readings. But now you have more systematic data, and then you can also see, actually that when they take medicine, their blood pressure goes down. And then how to adjust them. So you already call a personalized intervention. That's where I think it's really changing the dynamics and also improving the healthcare outcomes.
Yeah, I love that. What about mental health? Have you been able to find any practitioners that can help in that area too? I mean, that's such a large area in all facets of the family.
So we do have under our NeuroX brain health vertical, we have launched a telepsychiatry service line of brain health. Our philosophy is the same. Start with the risk assessment. So we utilizing our tool, the questionnaires, which the patients or their caregiver fill for them. And then it's essentially identify what's the risk for different depression, anxiety, PTSD, mood disorder, and so on there. So before a consultation happens, that screening tool allows them, to further a triage. It also helps a lot of primary care physician or provider or family like actually to have, a screen for those conditions. Once you are screened and now you want, moderate to high risk, then obviously we provide access to online psychiatrists, and then the psychiatrist then will build a customized plan, whether you need medication or you need a psychotherapy and so on there. So you can see how everything is. So this core principle of having this approach of the identify the risk and then triage for connecting with the online doctor and personalized care plan is across the spectrum. Whichever disease you talk about, I think that is the future of healthcare delivery.
Well, and I totally agree with you. And I love what you're doing. It's, it used to be that the body's the body, the brain is the brain, but there's so much that goes into your mental health that is relying upon some physical part
Absolutely.
of you. And so by integrating all of that together, I think it's super important and can help too in terms of a preventative when you get your hands around it at certain ages versus others. So I love that.
Definitely, I think it's a credit to the whole team and the physicians and the partners who have joined us. And I think I always say it's all about the united effort. I mean, there's no single company, no matter how big they are, that have a solution. It's about partnering up to build this ecosystem so the right care at the right time at the right price can be given.
Is there anything that I have forgotten to ask you about that you'd love to add or um,
I think that we covered pretty much. Obviously, we talk about AI. I think that's one thing I always now for my healthcare fellow physicians and professionals. I think when I remember when the electronic medical record system were introduced, so there were quite a few resistance initially. But then we saw how it became mandatory to have a data and all things there. Now, obviously, this AI has really is shaking up the whole aspect. So healthcare will not be different. I certainly see that there needs to be more openness, but I also would love to see healthcare providers, physicians, and other providers to not only adapt to technology, but I think they need to step up because they are the best architect. Because then they know how the workflows and processes work. And then they can partner with the technology companies to build some of the solutions which are essentially can be much friendly to use. So this is, I think, the momentum, the mission, what we are saying that, okay, this is how in the name of American TelePhysician, like, okay, the physician-led technology. And we have, been building some amazing platform backed by a physician, whether it's the virtual brain health. We recently entered one international contract for virtual kidney care platform and so on there. And now we're working on a virtual oncology. We also have a virtual oncology platform. And then, there's some amazing work being done inside. So I certainly see that with this combining technology into the healthcare expertise, then sky becomes the limit, and then this really will solve a lot of patients' problem and also reduce the cost significantly.
Yeah, well, thank you so much. I love that. So one last time, where do people learn more about you and find more research information, gain access?
Absolutely. So if you're a patient, you can go to Cura for You, www.cura4u.com. This is for patients who wants to like book healthcare service with price transparency and so on there. So everything in one marketplace. And if you are looking for any brain health issues and so on there, so we have this NeuroX, NEUROX.us. So you search NeuroX. And for our healthcare as a corporate site, American TelePhysician website gives you a lot of information about all of it. So because one of the area we would love to kind of partner up with the healthcare providers, growth companies, and then also having an international operations also. Certainly healthcare companies in the international market who are looking for innovative healthcare solutions and also physicians access to specialist physicians. We would love to kind of explore the collaboration opportunities.
Super. Thank you so much, doctor. We really
You're
appreciate it.
welcome. Thank you so much. Thank you.